All right. So I'm sharing my slides right now. If anyone can't see them, I know that's been a problem, but unmute yourself and just let me know. I know sometimes it takes a second. But just a reminder for everyone, sorry, this is meant for school personnel and health department staff. We will post these slides and the recording on our public website within the next few days. But just for the sake of time and reserving time for questions, we just ask anyone who's not with the school or the health department to drop off the call, please. And for those of you on the call, make sure any needed information is passed along to anyone else in your school who may need it. So to get started, last week we shared that the state had finally put forth some guidance on modified quarantine that they put together. They did update it just a little bit, and they put out a new version on September 10th. The only thing different is instead of saying they recommend testing once on day 3 through 5, they clarified it specifically and said on day 3, 4, or 5, because apparently that caused some confusion. And then they just changed their infographic. It says all the same information. It just has a little bit of a different look to it. They also say on the first page, the only additional comment is that this guidance was designed for K through 12, but it may be appropriate in preschool settings. So if preschools want to follow the state guidance, they're saying it may be appropriate. One question we're getting quite a bit, the state guidance says that if exposed or infected students, if one or both of them were not wearing a mask, the student who was exposed should quarantine at home for 10 days. However, then they say they may, after day 7, if they test negative on that day and don't have symptoms, can come back to school. But then just as a warning, that's in the text of the document, even the updated one. But then in the image, you'll notice that it now says if they test negative on day 6 or 7. So just to add to the confusion, but anyway, now they're saying apparently in the image that if they test negative on day 6 or 7, they can come back to school on the 7th. So again, that's the guidance from the state. Just as a clarification, we have our own guidance that we sent out, which offers kind of a bit more flexibility, but we did not include that specific guidance for a few reasons. One, we felt that if you have an unmasked close contact who only has one negative test at one time throughout their post-exposure time prior to 10 to 14 days, there is a high risk of missing infection and contagiousness. So we felt that we didn't want to take that risk. Plus, we just felt it adds a lot of confusion, making too many different changes. The contact tracers at the state do a lot of work for us, and their messaging will continue to say 10 days, so it adds confusion there. Plus, we know it's a lot of extra work for the schools to keep track of, did you have a test? When was it? Was it too early? Was it the wrong kind of test? Things like that. So that was why we did not include that in our guidance. However, we've given you permission to follow the state guidance if you want to. So if you want to follow the test to return at 7 days, you can. Just know that our messaging and the messaging from the state contact tracers will still say 10 days. So just know that if there's confusion there, that's just something you're going to need to clarify with your families, that this is guidance that you're following as an option. So anyway, I know it's confusing, but we chose to not use that option just to try to avoid a lot of that confusion. And again, it is just a riskier option. We did give the option, though, of people that were not masked could continue coming to school all along if they test daily before coming to class for the 7 days after their last exposure. So these are the guidelines I'm talking about. We had sent these out to everybody last week. They are posted on all 3 of our health department websites. It's all identical information, but just whichever website you're most familiar with. If you don't recall receiving this, or if you're like me, you have a zillion emails and you can't find it, it's always available there. Regarding that daily testing, this is one question we've gotten. I just wanted to clarify it. Within the images, it mentions that in an unmasked exposure situation, though the person that was exposed can continue to go to school if you feel comfortable with that. If they test negative each school day prior to attending class for 7 days past the date of their last exposure. In the text of the document, I did try to clarify that in saying that testing only had to be done prior to attending school. So in other words, they don't have to test on the weekends or holidays. If someone's symptomatic, they should always get tested, but this is for those people remaining asymptomatic. So we've gotten that question, do they have to test every single day? No, they just have to test negative in order to go to school for those 7 days. So just to clarify that. The state put out this week a document. Last week I shared a document on home testing meant for healthcare providers, which gives a lot of good information. This is one specific for the public. Their guidance for how to respond, like what they're telling the public to do in regards to test results, is a little different than what you have been told how to respond to test results for rapid antigen testing. So I'm going to work on some flow charts for this because when it's in long text, it does get hard for people to follow. I'm also going to work to update the flow charts that I have for helping you guys interpret rapid antigen tests because the current one we have now talks about quarantine and, we have some different guidance there. So I'm going to try to make all these different guidance documents a little bit easier for people to interpret. But in the meantime, this is a useful document. If you do have families using home testing, it can be helpful. So as we have in the last few weeks, in order to get an idea of your current area's data, I'd refer you to the My Start Map.info page. If you need any assistance utilizing that, just let me know and I can help work you through it. A few weeks ago, we've walked through that if you want to watch those videos. We're trying to get some better pediatric hospitalization data for our counties. I had mentioned last week that I pulled it for our counties using our disease reporting system, and that relies on us knowing that they're in the hospital so that we can check a box. We're finding that's not very accurate because we don't always know what kids have been in the hospital. The hospitals themselves report to the state, but that data is not easily accessible by county of residence, just by region. So we've had some talks with the state and we're trying to see if we can't get that data better broken down. We have one of our epidemiologists looking at things by hospital system. It's harder than it should be trying to get this data. But long story short, what I have for you right now is as of today, our regions are broken up as in this map. So you can kind of see where your counties lie. In Region 1, which only includes 2 of the counties on this call, Clinton and Gratiot, but many other counties like Ingham County. That region has 3 kids in the hospital. So again, it's hard to know, are they from our counties or not? They're most likely from one of the larger counties. Region 3, which only includes Gladwin and Aranac, has no kids in the hospital. Region 6, which includes the majority of our counties, has 5 confirmed and suspected COVID kid cases in the hospital. Again, that includes Kent County, which maybe the bulk of those, we don't know. And then Region 7, which includes our northernmost counties, has no kids in the hospital right now. What I did this week and what I'll work on continuing to do, last week I had pulled data for 2-week time frames. This time I went back and did it for 1 week at a time. That's the green line. This is all 19 of our counties added together. The green line is 2021. The orange line is the comparable date for 2020, just to give a comparison of how we're doing this year compared to last year. It's hard to really make any assumptions or, conclusions, but I just want to give you a comparison. So again, the green line is our 19 counties from July 7th until 2 days ago. So we've gone from 5 cases in school-age kids, 5 to 18-year-olds, to 319 cases. Last year, we went from 23 cases to 13 cases. As you'll see, some of our counties had summertime outbreaks last year associated with camps and their parents' workplaces and things. So they actually had higher rates in the summer than in the school year. So I'm going to go county by county. I did this for each county separately. It might be hard to see all of it as we go, but you will get these slides, so you will have this data. So again, the green line is going to be this year. The orange line is going to be last year. Note that the y-axis has different values. So some counties might have just single-digit numbers. Some counties might have high double digits. So, the curves might look similar, but they might be very different values. So just note that. So this is, first 6 are going to be Central Michigan, and then I think we have Mid-Michigan and then District 10. So for instance, like Clare County has double-digit numbers, Aranet County has single-digit numbers on the y-axis. So just to keep that in mind. So again, Clare County has gone from nothing up to 15 cases this year, whereas last year they really had nothing in the beginning of the school year. Aranet has had very low numbers, but they have had some increase this year. Isabella is up to almost 60. This is kind of a beautiful exponential curve here. Gladwin County on this side. Roscommon County has really not had any significant pattern. Osceola County on the right. Clinton County. Montcalm County, again, a pretty, and Gratiot County as well, having a pretty decent curve there. Kalkaska, Crawford, Manistee, Lake, Mecosta, Mason.
Dr. Morse?
Yeah.
I'm just wondering, there's a few of us who can't see these slides, and I'm wondering, I don't know if it's on your end or our end.
So that seems to happen every week to just a few people. I'll stop sharing. I'll go back to the beginning of these graphs. I will stop sharing and start sharing again. I don't know why this happens to some people, but I share my whole screen because I found in the past when I just shared.
I can see it now.
Okay, I don't know why that happens.
Me either.
Is there anyone else who can't see this? Okay, so just for a recap for those who couldn't see it, so this is, and again, you'll get these slides. This is all 19 counties. Clare and Aranet, green is this year, yellow is last year, orange. Isabella, Gladwin, Roscommon, Osceola, Clinton, Montcalm, Gratiot, Kalkaska, Crawford, Manistee Lake, Mecosta, Mason, Newaygo, Misaki, I'm sorry. Wexford, and then Oceana was one where they had an outbreak in the summer. So that's where you can see where it's very different from one year to the next due to some different situations. So again, I will send this out, and I made sure to have the data tables with it so you had those. And I will work on doing this each week so you can kind of see this trend as we're going. The following slides are from the state's data and modeling update. So Michigan continues to be at high transmission. The percent positivity and the case rates continue to increase, and they have for the last 2.5 months, although the increases are not quite as huge as they have been. We're still in the lower end in the nation when it comes to case counts and case rates. Pretty much all of the sequencing that's being done is showing that the Delta variant is essentially what is causing COVID right now in the state. The hospitalization rate went up from 5.8% to 6.8%. I should rephrase that. Of every hospital bed being used right now, 6.8% of them are being used for COVID. So even though we're near the bottom, like the 41st out of 50 states for cases, we're at the 13th out of 50 for inpatient bed utilization and ICU bed utilization. And our death rate is at the 25th out of 50th in the nation for number of deaths, but our death rate is the 8th out of 50. So I don't like those numbers very much. And unfortunately, last week, between the 31st and the 6th, we had 123 deaths.
I'm good.
So these are the rates that we've seen, the weekly rates in Michigan. There was a big drop over Labor Day, and this is primarily due to reporting, mainly people not getting tested or diagnosed over that time frame. So these are some of we see this over a lot of holidays. So this caused a little bit of a blip in our statistics, but you can see it kind of picked right back up where it left off. Right now, unfortunately, the age group with the highest rate for their age group are the 10 to 19-year-olds. The 0 to 9-year-olds are down at the solid black line, but they've really taken off since the end of August. So the 10 to 19-year-olds had a 38% 1 week increase, which was their largest to date. I included down here at the bottom last week, I reported that 0 to 9-year-olds had their largest increase last week, which was 28%. So they had another 10% increase this week. So that age group is having a big increase in rates. Our hospitalization numbers continue to increase, although maybe not as quickly, but it still keeps going up. The breakdown for age is here. The biggest age is the 60 to 69-year-olds. Our pediatric hospitalization rates, fortunately, are quite low. The biggest increase in the last week in hospitalization rates, unfortunately, was in what I like to consider a very young age group, which is the 40 to 49-year-olds. They went up 36%. Again, our younger population, fortunately, is not being hospitalized, but we're seeing some younger, increases in that younger demographic. So our pediatric data, I just realized I forgot to change this date. This date would be September 9th. This is the American Academy of Pediatrics report on national children data. So kids represented last week, so the 2nd to the 9th, which is their reporting week, that 28.9% of all cases in the U.S. that week were in children, and this was up 2% from the prior week. Over the previous 2 weeks, there was a 10% increase in the number of kids with COVID, and there was 10% increase in the prior 2 weeks. The amount of testing being done on kids, the amount of positivity, the amount of hospitalizations has all been relatively stable. So this is in Michigan. The dark line is the cumulative proportion of cases in that age group. The blue line is in the last month. So just showing that the amount of COVID we're seeing in our younger age groups over the last month is quite a bit higher than we've seen it over the entirety of COVID. The hospitalizations nationally have been higher than ever. They're starting to hopefully drop a little bit, although this most recent data sometimes is false just because of lags in reporting. The graph on the right is the pediatric or childhood hospitalizations in Michigan. So fortunately, we're not seeing that huge surge, but it has increased. I've shown this table on the left before, the bar graph, just really showing that in the nation, 46% of all kids that are hospitalized do not have any pre-existing health condition. In Michigan, it's actually 52.7% have no pre-existing health condition. So I know there's a lot of argument that only kids with pre-existing conditions get hospitalized, but unfortunately, that's true less than half the time in Michigan. So the number of outbreaks in Michigan, there were 80 new outbreaks this last week in Michigan in both the K through 12 setting and youth programs and childcare settings. So in any setting where the 0 to 19-year-olds were involved. Last week it was 40, so twice as many this week, and that's new outbreaks. So the numbers of people involved, I tried to compare it to last week here for you, so you didn't have to hunt through the last slide deck. But these are the number of cases associated with that. So in the elementary and preschool, there's fewer cases associated with new outbreaks, but there's still a lot in those ongoing outbreaks. We have a lot more in middle school and high school, and not too many administrative. So a lot more cases now than there were last week. So this is some data that the state is trying to collect through various means, and I'm trying to get a hold of that data just so we can try to analyze it a little bit better, especially for our local area. But they had that more than half of the school districts in the state did not have a mandatory mask policy, but due to the size of the schools that do have the policy, more than half of students in Michigan do have a mandatory mask policy. So more than half of students are required to wear a mask, even though less than half of schools require masking. So hopefully that makes some sense. And this is some data that U of M put together using that data, again, trying to look at what schools do have mandatory masking versus those that don't, and the rates of illness in those under 18. One is just the changes in infection rate per age group, just showing that there's been more increase in school age kids. And then the cases per 100,000 in counties where schools don't mandate masking for school age kids compared to areas where I think they define not all schools in the county require masking versus schools that require it in the K through 6th grades versus schools that require masking for all grade levels. So just, it's not the greatest data set, but just trying to find some evidence to support that masking does help keep cases lower in school-age children. So that is what I have for my slides today. I will stop sharing. All right, let me get to my questions here. So first question is, will school districts be provided with the date of return for students that have been identified as close contacts outside of school? And what notifications are required this year beyond those identified as close contacts and our website COVID dashboard, full class building district? So depending on what county and what health department you work with, our different health departments have done different things to notify the schools if they know that a student is a close contact and how long they should stay out of school. One issue we have is that we don't always know if someone is a close contact, so we can't always notify you. So I would encourage you to contact your county communicable disease nurse or whoever your point of contact is at the health department to discuss how you're communicating those things. And then what notifications are required this year. So I think the main things are to notify us if you know of someone who is a COVID infected individual, and then the close contacts you identify, and then, like you said, adding it to your dashboard. If you have any unusual occurrence or outbreak of anything in your school, you have to notify us. So if you have, all of a sudden you have 100 kids out sick with something, or any other unusual thing, whether or not it's COVID or flu or anything, we need to be notified. And again, if you have questions about that, your local CD nurse can help talk you through that. So can you explain the last slide again? Sure thing. Let me pull it up. So that slide came from, sorry, I can't talk and do it at the same time very well. Okay. That slide came from the state's weekly report. Okay. Let me just get to it and I'll show it again. Sorry. Okay. Share my screen again. Okay. All right. So it should be showing here. So what they did was they looked at the cases in individuals under 18 years of age, the number of cases per 100,000 in that age group only. They looked at them, the way I understand it, because all I know really is what's on this slide. They looked at them for that county. Make sure that it's where schools did or did not have masking policies. So schools that did not have masking policies, so did not mandate masking, compared to the rate of new cases in kids under 18 for that county versus or areas where they had some schools that had mandatory masking. It doesn't look like there were many data points for that, versus they defined partial as all the schools had a mandatory masking policy, but it was just for certain grades like K through 6, versus counties where their schools had masking mandatory for all K through 12. And each dot is one school district. So I'm not sure, case rates range in higher in counties. Like I said, I'm trying to get the actual data so we can look at it more closely. Because in some places they say counties, so like rates of illness in a county, or they say school districts, and we know that the population is different between a school district and a county. So I'm not quite sure how they pulled this together, if they're looking at the county where the school district is or the population. I know it's much harder to pull data for just the school district. So my hunch is that these would be data points for the county where the school district is. Again, I know that this is not great data and it's not, you know, it wouldn't hold up to a good argument, but it's kind of the best that we have at this point. I just wanted to share it. I don't think that that explanation is the best explanation I could ever give. But the slide deck, I don't want to give anybody vertigo here, so kind of watch your eyes. On this slide here, this link goes to all of those different reports. So it's in the slide deck for the 14th, if you want to look at that. And you can always pose questions to the state through just the general COVID question website. So again, I'm trying to get that data. I emailed the state yesterday when I found that slide, and they're seeing if we can get access to that data. The issue I have, frankly, is I don't even know for sure which ones of our schools have a mask mandate and don't, because things have changed. So it's hard for us to really look at data when we aren't 100% positive. We sent a survey out at the beginning of the year, but we didn't get 100% returns on that, asking, you know, what mitigation measures would be used. And I know things have actually changed since then. So, but we're trying. The slides I showed you today were kind of my attempt to try to show, you know, what's happening in your counties. And then if you know what's happening with masking in your counties versus other counties, that's the best I can do without more information. So are there homecoming dance recommendations? It's essentially the same as with prom or any other event. It's recommended everyone be fully masked, that they keep distance, no one have symptoms. I believe the guidance for special events is still posted on the state website. I can double check and see, but it's all essentially the same as it has been. The issue is it's just, I know that it's going to be really challenging to get compliance from your families and students on that. But I will look and see if we can find that guidance from last year from prom and graduation. And again, it would essentially be the same, but we'll send it out with the slides. Are there any other questions? So what about if the dance is outdoors? So there were some guidances, there was some guidance in that document about how to have it outdoors. So that definitely is much safer. At this time, we really feel you don't need a mask if you're outdoors, as long as it's not overly crowded. So you'd want to make sure there was plenty of room for people to space and distance if you have it outdoors. But yes, that would be safer. Has anyone put together data comparing flu outbreaks, hospitalizations, deaths, et cetera, for school-aged children and COVID-19 statistics for the same? there was a journal that came out recently which actually found that kids have had more complications from COVID than influenza, and I can find that and provide it. One of the big issues that gets overlooked is that, you know, we know that most kids don't have serious illness and hospitalization from COVID, but they take it home. And there is proof that that happens. There was a research article that did show that for every mitigation measure you add on, it reduces the risks of family members getting COVID while kids are in school by about 7%. So I know there's a lot of argument that, you know, it's not a big deal, kids don't get that sick. You know, unfortunately, it's a public health issue, not just a kid issue. But I know that's a hard thing to convince people of. But I can find that article that has analyzed the risks to kids of flu versus COVID, that has shown that kids have a higher risk of, you know, ICU stays, long-term illness, and things from COVID. I better start my list of things I need to send. Just the fact that COVID has gone on longer, there have been more deaths from COVID in kids than we typically see with flu. I mean, just numbers wise, because it's been a continuous thing rather than just a seasonal thing. So even though the rates might be lower, you know, cumulatively, it's exceeding what we see in influenza. Any other questions? All right, and if you guys think of questions or anything you want me to make sure and cover on Thursdays, just shoot me an email and I'm happy to make sure and do that. All right, well, we will get these things out to you, the slides, the recording, and again, the information on having safe events and the article comparing COVID and influenza in kids. You guys have a great remainder of your week, and we'll talk to you again next Thursday.